So thank you for taking the time. Got it. Okay. So good afternoon, everyone. I'm Ann Major, and I'm with the Centers for Disease Control's Comprehensive Cancer Control Branch. I co-chair with Katie Beachy, the Sustaining Coalition's work group for the National Partnership. I'm filling in for Katie. She normally does the check-in calls. And so in lieu of Katie, I'm also joined by Gail Parenteau. She is with the ACS. And so the two of us will be your facilitators this afternoon for a great call. So, okay. So what is the National Partnership? For those of you who haven't joined a coalition check-in before, there are 17 cancer organizations. We've been meeting together for over 20 years, since 1998, EC approach and across the country. So we facilitate and support and provide coalition information, webinars, and coordinate most of the CCC efforts across the national partners, so we don't try to duplicate each other and bring you the best, most relevant content we can. And we do these check-ins just to share on relevant topics that your coalitions are facing in current times. So the check-ins are an informal half-hour video call leaders. And so today's topic is worksite wellness initiatives with state government employees. Many of you are working in this topic. We've seen a lot of traffic about it on our coalition listserv. And so today we're going to have a presentation to kick off the topic from Sandra Henches and Zaria Lewis from the Missouri Comprehensive Cancer Control Program at the Missouri Department of Health and Senior Services. The program disease. So I'm going to turn the check-in over to Sandra and Zaria from the program. Are you on, Sandra?
I sure am. Can you hear me?
Hi. Hey,
Hello.
Sandy. So did you want to share your slides?
No. Zaria, do you have slides?
Just talking this afternoon.
Hi, I do not have slides, but I do have our prepared presentation because it was supposed to be limited to like one or two.
Okay, great.
I think there's too much to include in just 2 slides. So I do have the presentation prepared though.
Great. Then I'm going to just go ahead and turn it over to you, Ms. Zaria, because she was instrumental, along with Misty Phillips, in getting these lovely screening improvement projects up and running for our state employees. So I'm very grateful to the both of them and all the work that they've done and put in for this. And Zaria, I'm going to let you take it away.
Awesome. So to provide a little context, the problem was low breast and colorectal cancer screening rates among state employees. For example, when we started this project, the breast cancer screening rate was about 67%, and the healthy people target was 81%. And for colorectal cancer screening, it was about 51%, and the needed target was 74%. So we were pretty far behind, and we were assessing, kind of why this is, because these are state employees who are entitled to state-sponsored insurance as part of their employment. So we're like, why is this an issue? And in assessing the barriers, we found that it was due to a lack of knowledge of healthcare benefits, not understanding the age recommendations for routine cancer screening, the impact of COVID-19, people were unable to maintain regular appointments, and then barriers like getting time off of work. So then thus the Screening Improvement Project, or SIP as we call it, was born, and we implemented it in 3 key phases. And the first phase was an educational materials phase, where we sent out material on current cancer screening recommendations, and that was mass email communicated to all state employees. And the second phase was providing webinar trainings to the state employees to sort of test their knowledge of colorectal cancer and breast cancer screening before we had the screening events, and as well as to advertise for those screening events and keep that on people's radar. And then the third phase was the actual implementation of the on-site screenings, where we had our cancer screenings were done through the mammogram van that came on site, and then colorectal cancer screenings were done with take-home fit kits. And we also educated on other types of cancer and preventative measures. And then the plan was to expand and develop a toolkit so other organizations could take that, and we could do this across the state anywhere. And in terms of major successes, I think the biggest parts that made this successful was we had real life ambassadors that were DHSS employees. Sandy was one of them. And so we had employees rather than, paid actors who shared their personal experience as to why they chose to get screened. And I think that was very helpful, very relatable for people. And the educational webinars were also very helpful because it was a chance to clear up any miscommunications or misconceptions about what cancer screening entails. And to that point, we also had our content experts, such as a gastroenterologist and a breast radiologist, to answer any questions that people had. And we just deferred to the experts. So we made sure we were getting them the correct information. And then in terms of recruiting was very successful. We had to find the right balance between informing people and keeping the events on their radars, but not being too much and being too annoying to the point that they just block all of our emails. And so we did a mix of, flyers and social media announcements, mass communications, and then just like boots on the ground. We were in lobby tables asking people, have you heard of this event? Would you like more information on it? And some challenges was also the recruiting during the expansion part of the pilot after we done the first one, and we're expanding into other agencies as it was held in an off-site area. So we couldn't do our usual recruitment of, sitting in the lobby and waiting for people to come in. So as a solution, we kind of deferred to that building's wellness coordinator. They were a part of our planning team, and then they kind of came up with the recruiting and what would work best, as they know their coworkers and they know their work culture a little bit better than we do. And we also created that toolkit was a big help, as everything's kind of neatly packaged in a little bow, ready to be taken by any organization and industry. And we didn't have to be fully involved in every single step of the process because it was already right there. But just to kind of wrap up sort of our measures of success with this, two major measures of success and expected outcomes were lives saved and cost savings. Estimated that time off of work was saved by about 11,000 days, and the cost savings would be about $7 million per year, and a total of 61 lives saved by implementing cancer screenings and putting employee health and wellness on the forefront. I just hit my computer and shook my whole screen. And additional outcomes are obviously increased knowledge of cancer and how to access care, awareness of the importance of maintaining cancer and screenings, and increased cancer screening rates, productivity, and of course, using this as a model for other institutions to use. And that's really all I have for you. When we're still planning to do yet another one of those coming up, and then we're planning to do 2 a year roughly. And just a kind of recap now, the cancer screening rates are within 10% of the Healthy People 2030 goal. So we're working our way up there.
We're moving the needle slowly but surely. Thank you, Zaria. You did a great job on that.
That's awesome. Yeah. Thank you so much for sharing with that. We had a question come in. Did you survey employees on their cancer screening status prior to the project?
Yes. Sandy, would you like to go? Yeah, I thought you were gonna.
Yeah, we sure did. We sent out a survey not only on their cancer screening status, but also on their level of knowledge about the importance of cancer screenings, et cetera. So yes, we did do surveys before we started the program.
Another question is, have you completed work with the payers around client reminders or other payer-led interventions to go along with that?
So we did work very closely with our payer, the one who supplies our state insurance. They were very much a partner in this whole process. So they were not only informed, but also aware of the screening event. They also participated in it. And there is coverage that is a part of this for routine screenings. So we did work with them as a partner.
Okay. And who supplied your EE data?
Okay, so we have our own data, our epidemiology department here at the Department of Health and Senior Services. And that's where we pulled a lot of the data. We also pulled some of the data from our cancer registry database, and that's up at the University of Missouri in Columbia. We contract with them to do a lot of our cancer registry stuff. So we also had data from that particular source as well. So in-house and through a contractor.
Okay, and is a toolkit available?
It is, and I'm actively tweaking it as we go along just to make it, easily readable, but the meat and potatoes is pretty much completely done, and that is on our website. I can throw that in to the chat.
That would be great. And outside of the health department, what other departments did you work with?
Okay, so we also have worked with our Department of Corrections. Who else, Zaria?
A lot. We had about 20 partners. We worked with our state-sponsored insurance company. The Department of Mental Health was a big part of this, and that's, I think, who we're going to partner with for this next one. It's going to be at their home site in St. Louis. We partnered with our employee wellness. We partnered with local grocery stores. We partnered with actually quite a bit of departments and people. We partnered with lots of financial health and wellness institutions. All dimensions of wellness were covered within this. We partnered with a chiropractic team. Lots of all aspects of wellness were covered.
And we also partnered with Siteman Cancer Center out of
Yes.
St. Louis. That was a big partner for us. And also the American Cancer Society, our local chapter there in St. Louis as well.
Okay, and a question around the method of colorectal cancer screening.
Okay, we provided fit kits for folks to take home. We had a doctor on site so that if they were interested in, and if they met the criteria to take a fit kit, they would meet with the doctor before they took that home so that the doctor could go through a questionnaire with them and give them instructions on how to get the kits returned and how the results would be provided. We had community health workers to provide information and education around that as well, and also to provide referrals for other services as folks may need. So it was kind of a joint effort with the fit kit tests.
Okay, and a question around, did you include the types of partners in the toolkit?
Zaria?
Yes, I believe that is in the toolkit.
Yes.
Okay. A question around the type of test, that the fit test or Cologuard.
Okay, so it wasn't Cologuard,
No.
it was just fit kits.
Okay,
Yeah.
and did you maintain a return rate?
Yes, we did. And I would have to get the numbers for you guys on the return rate. I'm thinking it was close to 65%.
That sounds right to me. And I do know from the fit kits that were returned, 2 were referred on for additional testing of the people that we did get those back from. So I think that was very helpful. Even if it was only 2 people, I think that's fantastic.
That's right. That could be 2 lives saved.
Okay, and we had a question if someone wanted to come off of mute and ask a question. I think Jill.
I did. This is Jill Price. Is this allowed?
Hi, Jill.
Hi, Zaria. Oh, it's so good to see you and hear you. And
It is
hear
good to
about-
see you again. It's been a few weeks since we wrapped up our training.
Yes, yes. Okay, so who would have thought that you had this up your sleeve, that you've done this with the state employees? So when you were at the Department of Corrections, you only did the employees, right? You didn't have anything to do with the patrons.
Correct.
Okay, and then there's some things that I don't understand, like how you got your data for, but so I'll ask that offline. But did you open this up to spouses and families who were also covered under the health insurance policies?
No, we did not.
No, we didn't, because we're looking at this as kind of like a pilot. So, we're going to increase our reach, and as we're going along and kind of evaluating the success of these things, we'll go ahead and incorporate that. But for this, to keep it kind of simple for our first run through this, we were just doing employees.
And then did you have the medical director or the governor's buy-in, or who was your highest champion?
We
Not
had,
that they- Mhm.
so we had the medical director, we had Dr. Heidi Miller and Dr. Jacqueline Miller were big proponents of this. And then we did actually get the governor's, not the governor's award. We applied for the governor's award, and we did meet with Governor Parsons on this, and we got the colorectal proclamation for this.
Great.
Thank you.
We have a question in about how you handled the situation if someone did not have primary care to handle the results.
We had the CHWs were a part of that navigation, and they were instructing them on other resources and things that they could do in addition and the follow-up process if something did come back, and how to arrange that. And that was done more through Siteman. They had their team and they did the follow-up for us.
Yes, it was their CHWs that were involved in the navigation process if people did not have a primary care provider.
Did they donate that time, or was it a contract?
They donated their time.
Wow, good work. Good
It's
work.
pretty awesome.
Okay, so I think at this time we want to open it up to talking about other programs that have worked with their state government and employee worksite wellness. Does anyone else want to add to the conversation?
And I think Rachel Davis has her hand up.
Okay.
Hi, thank you all for
Thank
this
you.
conversation. Very, very exciting. I just wanted to mention that we're doing something very similar in the state of New Mexico. We're working actually with, instead of state employees, we're working with city employees. And so I've coordinated a relationship with the city of Albuquerque and their wellness team. The city of Albuquerque has also health ambassadors. And I actually built a relationship within the city and their health plan and their health plan's QI department. So we're going to be launching a program in November. There's going to be like a lot of promotion and collateral. The city of Albuquerque has these things called Jimmy boards throughout the city, as well as a local on-site clinic and a mobile clinic that kind of goes out into the different rural areas, thinking through health equity to promote colorectal cancer screening with the city employees. And in this kind of connective tissue process, it's being supported by Presbyterian Health Plan that will be providing Cologuard tests for city employees. And it's going to be done in a couple of different ways. One, the city employee can actually pick up the test on site at the wellness clinic. Two, they can actually sign up for the kit. Three, they can kind of click a QR code that will have the kit be mailed to them. And the Presbyterian Health Plan will be taking on all of the data collection. And ACS, will be working towards providing all of the various screening collateral And so I'm excited to see how this really comes together. We're very excited about it. It's sort of a first-time partnership, but it's very similar, I think, to what you all are talking about here today. So I just thought I'd share some of that work that's going on here in New Mexico.
Awesome. Thank you. Any other hands, Gail? Let's see. Let's see.
Nope, I don't see any other hands.
Is anyone interested, before I get to resources, is an ongoing small group. So would anyone be interested in meeting as a smaller group to discuss this topic further? I see yeses coming in. Oh yeah, it's a popular topic. I'm glad we're all getting together soon for our business meeting in September. Lots of interest. So we'll send out some information on how to and get that organized and going. And in addition, we have some resources available to you in our presentation today. The ACS has the CEOs Against Cancer, and there's a link provided in this slide to that. And so we'll send this out for everyone to see these links. A plan to increase cancer screening among employers. And that has another link to that resource under the ACS or ccc.org. And then 80% in every 80% in every community employer challenge is another one. And then, whoops, let me go back. And then we have from the GW Cancer Center, we have policy systems and environmental change, real world examples on worksite wellness from Indiana, Michigan, and South Carolina that all had projects on worksite wellness. So they're listed in their real world examples at the GW Cancer Center. And there's links to that that'll be available. And then under CDC, we have workplace health promotion kit and information. And of course, what's lopped off, you might not be able to see it, is the community guide and the resource on worksite wellness under the community guide. So all of these links will be available to you. Oops. Okay. So, yeah, we only have 5 more minutes. I wanted to let you know that our next coalition check-in will be November 7th for another one of these short 1/2 hour video calls. So look forward to that as our next one that we have. I can paste those in the chat. Yes, that's a good recommendation. I'm gonna paste the links in the chat. Here we go. Well, I don't know why it's jumping so much. There we go. And I can put, oops, every time I try to copy it, I'll leave that to Gail. Every time I try to copy these out, it jumps off the screen.
I put it in.
Put it.
Yep, all set. People can see.
Thanks. Let me see. Oh. Yes, we're planning to send the slides out so you can have a copy of these resources. And thank you so much, Rachel, for sharing around New Mexico's project, and to Zaria and Sandra for presenting on the new Missouri project. And again, you can access the article about that project in the Preventing Chronic Disease Journal. We really appreciate everyone's time in joining these coalition check-ins. I think it's a really good information, real world examples in real time of how we can help each other and share information on the way we've gone about doing cancer prevention work. And this topic seems to be a real popular one right now. I know a lot of the programs are looking internally into state employee wellness as well as major employers in their communities. So it's always good to get that screening rates back up to pre-COVID levels, hopefully soon. So Catherine has a recommendation to share how this looks like in a work plan, this type of strategy. So if you're talking about like an example that we provided in the AMP guide, we could certainly, I think, put together what it would look like in a work plan strategy laid out like that. Good question. Okay. Okay. I went on and clicked on the links prior to putting them in the slide, and they worked for me. So if there's something that's not active, it may just be a temporary, because I think everything worked when
The link that I placed in the chat, and that she says is not live, but it's to the National Partners website, so there shouldn't be any issues. We're not aware of a web page being down. I don't see that Gail put the links in the chat, so I think it's referring to the one I put in the chat.
Oh, okay. Yeah, I checked them all before they went, but we will make the slides available. So if you don't catch it in today's chat, we'll definitely have them for you and disseminate them out. Okay, so that will conclude our check-in for today. We look forward to seeing you again next time in November, and I'll see many of you, in fact, probably most of you, at our upcoming business meeting in CDC main campus, September 19th to the 21st. So thank you so much. And thank you for participating in today's coalition check-in. And we look forward to speaking with you next time. Thank you.